Hi everyone, this is Dee Dee. I wanted to document day 3, 4, and 5. Today's the 5th day. Day 3, it was a little challenging, I guess, mentally. It was really mentally. I was scared to go outside, so I just walked around in my apartment. Let me turn around. And because I was still feeling a little, how do I explain? A little uneasy, meaning like because I was taking the muscle relaxers, I had a lot of, how do you say it? The neck down to my hands. A lot of like muscle tension. I kept feeling the pull. So that's why I took the muscle relaxers, but I felt like it wasn't, how do I explain? I don't think it was doing anything for me. It just made me dizzy. You know, muscle relaxers make you kind of tired, like, but I felt like I was up after 2 hours, so it didn't feel like it did anything for me. My friends came to, check up on me. I didn't really sleep as much because at nights I'm still having trouble trying to sleep, meaning finding a comfortable spot for my neck without having to, like, say like you're sleeping flat, right? It's hard for me to get up. Technically they want you to do kind of like a roll, meaning like, say this is your spine, and say like the fingertip is my head, right? They want you to kind of like make your whole spine like roll at the same time. It was hard because technically my bed is on the right side, and as you can see, it's on the right side. So it's like leaning on my shoulder while I turn, so it was so difficult. At the hospital, I said it was so hard for me to do it. So anyways, that's why I've been trying to figure out how to sleep on the couch, meaning I don't have a recliner, so I have tons of pillows because over the years I've been trying to like find the right pillow for me. But anyway, I'm glad I have all those pillows. But I propped it up so it's sort of like I have an incline, and I have a footrest so I could like lean out. But I found on day 2 it was hard because there's a lot of pressure on the lower hip. So last night, which was day 4, I propped up pillows on my bed, and I was able to sleep sort of reclined without straining my neck too much. But that too I felt was uncomfortable. I mean, you gotta really think about, it's the new normal for pandemic. But anyway, I'm talking about my new sleeping. Oh, sorry, I had to scratch my neck, my head. Oh, I'm still trying to learn how to relax these shoulder muscles as I turn. I know they don't want me to move my arm as much up. But, I'm just going to say that if anyone is considering surgery, please get PT before to strengthen your muscles. I really wished I concentrated more on my core as well. I did mostly my arm and neck, I'm really grateful. They helped strengthen my neck. I was so weak. And my shoulders, arms. But I wished I concentrated more on my core, my stomach, because literally the core, of course it's your core, it supports you in all ways, but especially when you're inclined and you don't want to use your neck muscles too much, your core would definitely help you be, really lift you up. So that really helped, try to engage those stomach muscles, and your back muscles. You need both. I wish I really did most of it to strengthen it. However, it was hard for me to exercise a lot too because of obviously the nerve pains and the headaches. It was difficult, so I did gain weight. I know at the hospital they say, "How much do you weigh?" I know I gained weight. It was an easy 7 pounds within, was it September, October, November, December, January, February, March, yeah. Within the 7 months since I really felt the extreme pain. So I have my pillow here. I don't know if you can see. Sorry, it's hard for me to turn my arm and my neck. So on yesterday, day 4, I was sort of like trying to figure out how to alleviate the muscle pain in my mostly everything was on the right side, and I thought, sorry, I meant the muscle aches. I thought it was because of an incision that was here. But anyway, I called the doctor, and he managed to call me back and to kind of go over my symptoms, because I just couldn't sleep at night and just having that muscle aches. He said to take the Percocet, oxycodone or something like that. I know I don't want to take that. That's really heavy duty, and that really backs you up. But, I do have Colace and Miralax, stool softeners. But anyway, I'm just going to say that I'm not the type to really take medications or over-the-counter pills when I don't really need to. But anyway, I told the doctor that too. Excuse me. Kind of had to burp a little, sorry. But it sort of like it affects my throat too. I'm trying to relax my muscles right now. So anyway, the doctor said, okay, I can take the oxy, but I can stop the Miralax. The anyway, the muscle relaxers. Because I told him, it wasn't really working for me, and he was like, oh, you can stop that, because I said it was making me feel like, lightheaded, and I didn't feel safe walking by myself. So he said, oh, I could stop that, which makes sense, because I wasn't sure exactly. I thought if I take the muscle relaxers, that would help release the tension. But since he said that it wasn't really doing anything for me, he was like, just stop it altogether, and just take as needed. Even the oxy. And then the stool softeners if I take the oxy, the heavy duty meds. So he said that I can take 2 of the ibuprofen to help with the pain. So I'm taking that. Actually 2 of the naproxen. I have naproxen 500 milligrams. So I'm taking that. I took it for the first time last night. I'm using my neck muscles, but It was just like every so slightly. I always try to be cognizant of like not moving my neck too much. I did take the brace off. Anyway, I took the brace off because the I think the seam in the back, because I have a small neck, it was causing like it to be sort of uneven. Sorry, I was looking for my brace. So if you can see, you see that lip? You see that there? So, and then this part right here, I'll explain. So that lip I mentioned about, it was hitting literally in the back of my spine. So it caused me to sort of like not be this way, but it tilted my neck, so it's like uneven. And I was wondering like why I kept tilting, moving left and right. I thought I was always in that neutral position. Obviously they want you in that position. And then I realized that it was the neck brace. I felt my neck was strong enough to withstand without it. I mean, even the doctor said that it's okay to be without the neck brace, but just use it for safety reasons, which I wanted it. He didn't want to give, well, I didn't say he didn't want to give me. I actually requested the soft brace because I wanted to use it if I go walking, and I actually, little things, accidents do happen. So that's why I wanted the brace, just in case. But yeah, I realized that to sleep with the brace was a little difficult, but I wanted to use that because I didn't feel like my neck was in that neutral. I wanted to sort of like understand where my neck is at that point. I know at the hospital it was difficult because, again, I guess I can't expect the nurses to understand it, but they kept, whenever I got up to use the restroom, which they of course helped me out of bed, in and out of bed, some of them were very careless. They just literally propped the, how the beds, you could always recline up. Some of them would drop it down, and of course you're on meds, and I wasn't thinking, of course you're not focused a lot, you're in pain or whatever you may be. I was on meds, so I was just kind of like, in and out. And I noticed that every time I always have to like strain my neck to like get in bed and out of bed, because no one taught me how to get in and out. The PT trainer nurses, I'm not sure the exact title for them, but they train you how to get in and out of bed, bathroom, how to change clothes, the basics like bathroom, correctly, safe, how to walk by yourself in case. So I wish they sort of came to me earlier, which makes sense. I don't know why it's at the end, because technically the nurses didn't really properly help me, especially getting out of bed, so I kept straining my neck. So anyway, I wish that was trained before to be more knowledgeable about it, which, you know what, I'm going to probably suggest that. So anyways, yeah, I always suggest to have your core, your muscles from your front and back, stomach to back muscles really trained, because that will really help you. Yeah, I was surprised I could talk when I spoke to the doctor yesterday too. He was surprised that I was able to speak. I wouldn't say surprised. He said, everyone is different, but I was able to talk and eat soft foods, so that was a good sign that my esophagus wasn't as what's the word I should use, like I wouldn't say tempered, you know, because they have to put the, what do you call that? The tube in your mouth. Anyway, I don't know all the terms. And also move all your cords over. Yeah, move it over. But yeah, my friend came over last night. He's in the medical field, and he looked at the stitchers here, and he said it looked really good. It's really clean. I mean, as you can see, it's bloody, but that's because I forgot that it starts with a D. Anyway, this is a bandage mesh thing to keep the stitchers like together. Anyway, he said it looks clean, like really good. So hopefully my scar will just be like a line, you know, like your fold in your neck. I remember getting in pre-op, you know, before, you know, when the doctor came in to talk to you, you know, usually you talk to them before you get into surgery. And he was like, you know, we make an incision where your lines are. And he said, I guess you're lucky you don't have any lines, so I'll make a line for you. He grabbed the pen and started marking my neck. I mean, obviously they mark your neck so they know where to make the incision. So I have battle scar, you know, like I have proof that this is not my natural fold. It's an actual, somebody was cutting my throat. And no pun intended, but I did mention to the doctor before, during one of my visits, pre-surgery visits, I told him my symptoms felt like, well, one of the symptoms, it felt like somebody was cutting my throat. Literally, it felt like a sharp thing across my throat. And he said, no one really mentioned about that symptom. I'm like, well, I'm telling you, this is how it feels like. Someone is like cutting right through my throat. And so there it is. But yeah, I'm still feeling, I'm pacing around in my apartment. It kind of drizzled today, but I think I want someone to walk with me just to be sure. Because I know in the hospital when I did that PT training thing, when they checked, you know, to see if how far I can walk, I did get lightheaded, so that's why they gave me a cane. Yes, I have a cane here. Yeah, I have a cane. But I don't know. My throat has been feeling a little better each day, so that's good because it was scratchy, a bit scratchy in the beginning, but I knew I could eat. I just had to eat very slow, especially on day one. Oh my gosh, that was so bad. I don't think I explained, but day one, because you're coming off of anesthesia and they have you on other meds, pain meds. Sorry, I had to move. I remember, well, they chopped up my food, and I think I should try to put a photo in it. I was eating, and you know, like I noticed I was kind of dozing off in between bites, like I was eating really slow. And then I think once I caught myself, I fell asleep while I had food in my mouth while I was chewing. A couple times I caught myself, the spoon in my hand, trying to scoop the food out, but I couldn't. I fell asleep. So, so it's kind of funny, but my medical friend, don't exactly know his title, so that's why I call him medical friend. He said that when he's at the hospital, he does notice that people fall asleep because they're on meds or what, and I guess I'm laughing because I can relate to babies falling asleep with their food or in their food, or like in the movies where you kind of doze off into your plate. I did not do that, but um, yeah, I don't know. Like, I guess my number one issue is the sleeping, and second is making sure that my neck is in that neutral position. I honestly, I don't know what is normal. Like, how do I say normal? Because I don't know if I can get a profile. My chin used to be outwards, so my whole cervical spine was kind of like, in the x-rays and the MRIs, they're all straight, when technically it should be have that little curvature. I don't have that in my neck. Part of it is because my chin was, I don't want to do it right now. Actually, I shouldn't. I'm not going to do that. It was out. And anyway, so my neck posture was just bad. That's what I'm saying. Sorry, I'm just rambling, but I just wanted to share that. But I don't know. Oh yeah, 1, 2. I mentioned 1, 2, and the third thing is my walking. Okay, 1 is sleep, 2 is neck posture, 3 is walking. So yes, my attempt today is to walk outside. I know I should be walking the other days, but I just didn't feel safe doing it alone. I know I have friends come over, but it was just one of those quick in, out sort of deal. I don't know. I'm trying to rest more. Maybe I should try to get a couple hours, because last night I couldn't sleep as much again. But I am starving. I guess that's a good sign, right? Where to go from here? Yes, always. It's really hard for me to ask for help. Because I am independent. I live alone. I don't have family here. But this journey is I guess a blessing in disguise. It teaches you who's there for you and who isn't when you think they would be there. Or some that do a lot of talking but no actions. I don't know. Today's day 5. It's gonna be a long process. I just have to evaluate for 2 weeks how my neck will heal. I do see the doctor on week 3. He'll remove this bandage thing here. Right now I'm itching. Yesterday I started to itch. Oh, I didn't know that. Yeah. So yesterday after speaking with my doctor, he was like, you can take a shower now. I was really scared. I guess I just needed someone like him to say it's okay to shower. I know of course, they always say after day 3, but I think just needed someone like him to just say, yes, go ahead. So I did. It felt so good to shower. So relieved. I mean, I did have a friend to help me on day 3 to sponge bath me, just the shoulder down. But anyway, you just gotta really clean the area, just pat it. Anyway, so yeah, I finally showered my hair too. I was really excited. My hair is short. My hair used to be like down here, I guess. I don't remember how long. I did cut a lot off. I just didn't want to deal with my hair. I figured it'll grow out, so I'm not fretting about it. Anyways, I'm gonna close off and get some rest. So I just wanted to say, be mindful, be kind. Like, really be mindful and be kind. Don't judge people by its cover, because you can't see their pain, you can't see their struggles behind what you see. Anyways, happy Sunday. Bye.